Hello, my name is Austin Barber and I'm a rock climber. So for my video, I'm going to be discussing some muscles and some tendons of the hand that allow you to flex the fingers and to pull on holds while you're rock climbing. So let's orient ourselves first here. We've got an anatomical position. We've got an anterior view of a right hand here, so we're looking at the palmar aspect. And the first muscles I want to talk about are these lumbrical muscles right here. So these lumbrical muscles are intrinsic hand muscles, meaning that they have their origin and their insertion inside of the hand. So these muscles, they originate not actually on any of the bones of the hand, but they have their origin on the flexor digitorum profundus tendons here. So when they originate here, the fibers of that muscle belly are going to run, and they're actually going to run from the palmar aspect onto the dorsal aspect, attaching to the extensor hood, which is going to cover both the middle and the distal phalanx. So the result of contraction of this muscle is going to look like this, where we have flexion at the MP joint here, but we're going to have extension at both the proximal interphalangeal joint and the distal interphalangeal joint. So this is good if you wanted to do something like grab a large ledge, but as you start grabbing smaller and smaller holds, less and less of your finger is going to be covered, so we're going to have to involve some different muscles. So we're going to have to involve some extrinsic hand muscles, which means that they have their origins outside of the hand. So the most superficial of these two muscles that I'm going to talk about is flexor digitorum superficialis. It's going to come from its humeral, its ulnar, and its radial head outside of the hand, and it's going to split into four tendons. They're going to come through here underneath this flexor retinaculum, and we're going to have those four tendons that are going to move to digits 2 through 5. And they're going to run all the way until they insert here on the middle phalanx of digits 2 through 5. So the other muscle that I'm going to talk about is flexor digitorum profundus. That muscle, as its name implies, is going to be deep to flexor digitorum superficialis. It's going to come from the ulna and from the interosseous membrane that's in between the ulna and the radius of the forearm. And that muscle is similarly going to come through and split into four tendons coming underneath this flexor retinaculum here, and the four tendons are going to run on digits 2 through 5, but they're going to run all the way to the distal phalanx of digits 2 through 5. So they run all the way to the end of the finger. So those are the muscles we're going to use if we're doing what's called crimping, and we're using just the tip of our fingers here to grab really small holds. So when you do that and you put lots of strain on these tendons here, what can happen is there's a few injuries that can result from that. The two most common ones are flexor tendon strains, so where we actually have tearing of this tendon or the muscle that it comes from, or we can have pulley sprains. So we have different types of pulleys here. We have the annular ligaments that are running across here, and then we also have cruciform ligaments that aren't pictured in this diagram, but just know that they're there. So these annular ligaments, they kind of hold this flexor tendon to the bone. So when you're putting a lot of strain on that, you can have tearing. The most common is on the second. So if we have A2 tearing, that comes in grades. So we can start with very, very low grades, very minor tearing, all the way up to what's known as bowstringing. So when bowstringing happens, you have a full tear of the A2 pulley, and when you were to flex your finger like this, there's nothing going to be holding the tendon to the bone, and so we could see the tendon running straight from this middle phalanx here to the palm of the hand, and it visibly stretches the skin out here if you were to flex your finger. So with these flexor tendon strains, they also come in grades, and those correspond to the level of tearing that's involved. You can have completely dislocated tears, so the tendon completely detaches from the muscle, or there's a complete tear in the muscle somewhere. Oftentimes you have to have surgery to get those put back together. But if you're just going along and you have some pain in your finger, there's a way that we can use a little bit of our anatomy knowledge to try to diagnose what this issue might be without actually seeing anyone. So we know that these annular ligaments are contained just to the hand right here. So if you have pain in your finger, you have referred pain that goes all the way down into your forearm, that might clue you in that, hey, this is probably a flexor tendon strain, because I know my flexor tendons attach to these muscles that go all the way into my forearm. And so that's a way we can use a little bit of anatomy knowledge to think about how we rock climb and think about some of the injuries that we might sustain.